Hey, everybody. Welcome to a special episode of The Ethical Frontier. We have three guests today. We have Dr. Hedy Wald, we have Dr. David Shuster, and then we have Dr. Ashley Fernandez. And we're going to talk about medicine in the Holocaust. Thank you so much for being here.
Thanks for having me and us.
All right, so I think a good way to go about this is kind of break it up into three parts. And I think the first part, I think we should talk about like how some doctors participated in the Holocaust, like what the role of medicine was in the Holocaust, and then we can talk about why they participated. Given the goal of medicine is to heal people and save lives, and then I think we should end on what do we need to do in order to prevent this from happening again. Okay. So why don't we start with that first question? Like, how did medicine play a role in the Holocaust? How did some doctors participate?
Well, I guess I'll start. I teach at the Ohio State University College of Medicine, and I teach a class on medical ethics after the Holocaust. That's what it's called. And one of the things that we try to make students understand is how did physician participation in the Holocaust come to be? And I think what the first sort of myth that we have to really get over is that when you think about Nazi Germany and you think about the being in an oppressive fascist regime, your first inclination is to naturally think that physicians were forced to participate in Nazi activities and forced to participate in some of the atrocities that we know happened both in and out of the camps. And that is absolutely not true. One of the sort of more shocking things is that physicians joined and medical students joined the Nazi party in droves. They joined at 7 times the rate of other healthcare professionals. They were happy to do it. And that the atrocities that we think about that happened, medical experimentation, even the death camps really could not have happened without the active participation of physicians in the Holocaust. That is, they believed what they were reading about racial ideology. They created ways of executing that on a mass, first on an individual scale and then on a mass scale. And they were heavily influenced by the culture around them, which was a predominantly anti-Semitic culture, which looked at vulnerable people as not of use to the state. So I think you can see this temptation when you're a physician of having a lot of power that society hands over to you freely, and then the ability to influence culture through that power. So those are some temptations, and I think that's how I'll start. That's one of the things. Physicians were not pushed into it. They actively gravitated to it. And that's something we as a profession have to reckon with and have to teach to the next generations.
I think that was a really nice answer. I don't have too much to add to that, except I did want to say that I am very gratified and honored to be a commissioner for the Lancet Commission on Medicine, Nazism, and the Holocaust. The Lancet Medical Journal is the most widely read medical journal in the world. And the editor of that journal decided a few years ago that he wanted a commission on this topic, how important it was. And I wanted to alert viewers to that, listeners, that there's an 85-page report of all of this history that documents the continuum of how doctors were using their moral agency to be involved in this, as Dr. Fernandes has mentioned, that they were not forced, they were not coerced. Anyone that did not wish to participate in this way could, but most people did not resist and actually enthusiastically participated along that continuum of embracing racial hygiene, persecuting Jewish physicians at the time, which created some career advancement opportunities for them because there were now new job opportunities. There were papers to be written with bodies that were used for anatomy departments, victims, and they eagerly participated. Dr. Shuster?
Thank you, colleagues. Thank you, Jason. I've had the honor of directing the Physicians on the Holocaust course at Boonshoft Wright State University School of Medicine for 10 years. And I mentioned that title being Physicians on the Holocaust versus Medicine in the Holocaust because these were physicians making individual choices, making individual decisions. Physicians who are people who have personal responsibility, whereas medicine is a field. It is a nondescript entity. So the physicians were in charge of their destiny. Imagine the physicians, which is what I do with the senior medical students in the course that I direct. Imagine people like you in Nazi Germany in 1935, for instance, where the entire milieu that has been created by the Nazi regime is one that has used the Jews as a scapegoat for Hitler wanting to just be rid of the Jews, regardless of what it did to his war effort, but also as a way to mobilize people to say, aha, here's something bad. Here's something, if we get rid of these, everything will be better. So Jews were looked at and had been, certainly with anti-Semitism being a very old concept, he was able to release it from its cocoon of possible repression and say, we're going to use this for all it's worth. And by enlisting the physicians, he was able to meld, as my colleagues have said, science and culture and have mutual influence by using the respected physicians in white coats to help legitimize these views. This could all become more powerful. So the populace became convinced of Jews as a disease, as a gangrenous appendix that needs to be removed in order to assure the health of the Volk, of the German people. So we have that milieu, and we have, imagine each physician saying, if I join the Nazi Party, good things will happen. It is easy to go with the flow. It is, I don't want to use the term easy, but to be able to think as most of those around you are thinking is an easier path to take. To say, okay, I'm buying into this. I will help the German people by sacrificing individuals.
Just wanted to make one more comment. And I was thinking as you were speaking, Dr. Shuster, that the ethics of the time that were taught in the medical schools were not abandoned, but they included that there were some lives unworthy of living, and the authoritarian rule of the state, with the state as the patient, the state, the Third Reich, taking precedence over individual patient care. These ethics were adopted at that time and taught. And I think that if you speak to folks about this history that may not have read that much or know that much about it, they may think of a Dr. Mengele because they've heard something about terrible experimentation, but they may not understand the pervasive nature of this within not both individual physicians and scientists, but also the medical profession itself, that these were not just a few bad apples, but that it was pervasive in the society. And I just wanted to read one quick quote from a first-year medical student, because we're always interested in impact of the teaching of this. And he said that realizing our connection to the past is crucial. It's especially important to not dismiss physicians who were complicit in the Holocaust as simply evil monsters. We all have potential to do good or do bad. We have to be critically aware of this, close quote. So that these were not just a few evil monsters. It's hard to wrap our head around that, but these were people related to the most prestigious medical and research institutions of the time.
Thank you for that answer. For those people who don't know, can you give examples of what some of the doctors did in the Holocaust? Like you briefly mentioned experimentation. Are there other examples?
Well, I'd like to begin by describing the physician's role in euthanasia of people with severe disabilities. That's how the Holocaust started. To be able to say, these are people who are living lives unworthy of life. These are people that imagine yourself being them, imagine them being your family. Wouldn't they be better off not being alive? That could even be called the golden rule. Do unto others as you would have them do unto you. Yet that's very easy for us to put our perspectives into someone else's mind instead of saying, what would that person want done to them? So that's how it started. That was, to use a bit of a trite term, an easier sell. Let's get rid of these people with severe disabilities. And that can morph into let's continue to get rid of, to get rid of, to get rid of.
Interesting.
Yeah. I mean, a specific doctor's name, for example, for your listeners who might not be as familiar, is Karl Brandt. Dr. Karl Brandt was considered one of the most famous, influential physicians of the time, and he was in charge of this euthanasia program, which is called the T4 euthanasia program. It actually, even before the T4 program started, there was a program to murder disabled children. And at that time, these were always supervised by physicians. They didn't have gas chambers back then, but what they would do is they would take the disabled children, they would put them into a room. And Hedy and I have been there. I don't know if David has been there, but we've been to this place just outside of Berlin, just it's inside Berlin, but it's in a hospital. They would take them to this room, and they would attach a hose from the exhaust pipe of a truck and attach it literally to the wall of this room and pipe in carbon monoxide gas. And these children, you can still see, like, they have the part of the door where fingernails were scratched. These children basically died inside that room. And the idea was they would not be missed. Karl Brandt was captured after the war. He was put on trial at what's called the Nuremberg doctor's trial. And at this trial, he defended himself, and he defended himself in a very rational way. And as Dr. Shuster suggests, he said a couple of things. He said, first, what I did wasn't inhuman. It was really to end the suffering of these people. And then he mentioned that, hey, if anybody wants to question, I'm paraphrasing here, but he says, if anybody wants to question the morality of what I did, here's an idea. Why don't you go and stay in an insane asylum for 3 days? And then at the end of that stay, we can ask you, would you yourself want to live like that? Or would you put someone who you loved, like your mother or your child, in that place? And he was trying to get an audience, the public, to think that this was the humane and rational thing to do, would be to put these people to death or put them out of their misery. You can see what happened even before the euthanasia programs in this idea of eugenics, where essentially Germans, or not Germans, but the German regime, the Nazi regime, started to concretize these ideas that there are some genes, they didn't call them genes, but there are some populations that are better than others, and the good race should be promoted through births, and the bad parts, the races that contributed or polluted the gene pool, essentially, should be eliminated. When you build a eugenics program and you concretize that through law, and these were called the Nuremberg laws, by the way, that is why after the war they had the trial of the doctors at Nuremberg, because it started in Nuremberg and then it ends in Nuremberg. But anyway, the Nuremberg laws sort of concretized or solidified these eugenical and racist beliefs into law, which has a powerful influence on culture. From there, you can see how easily you could slide into a euthanasia program, right? So we don't want these people to reproduce, so let's eliminate them altogether. And from there, taking the most disabled children and adults in the population to being able to then take it a step further and say, let's start to eliminate different classes of people who we think are inferior to us. And with the help of doctors and research scientists, they developed efficient ways to do this on a massive scale.
I don't have a lot to add again, except to say that it's been said that the Holocaust started in the dark basements of hospitals. And I always find that medical students, faculties, nursing students, dental students that I present for are shocked by that. And I think it's something we need to grapple with in our health professions education and practice, that here we had what was considered the most prestigious highest level of culture, the most advanced, where even folks from the United States would go study there, capable of the most harm. And I don't think we've fully come to terms with that at this point. I think what's so shocking is that the physicians were so involved in so many ways, whether it be sterilization of the disabled with 250 hereditary health courts where there was little marks in blue or red of whether someone would be sterilized, and then moving into the T4 euthanasia, quote unquote euthanasia, because it was actually a forced murder program. Um, and then being able to participate in horrific abuse within quote unquote experiments, and all thinking that for the good of the science, we could do it anything we want because we have a bunch of subhumans. We have, as Dr. Shuster said, lives unworthy of living. This is our ideology, and we're good to go. No evidence of scrutiny about this or debate in the public. No evidence of scrutiny or debate in the medical associations. And it took probably 40, 50 years to even have the German Medical Association to apologize for this. And that was in 2012, published in JAMA. Even issues that we've had with remains from experimentation been sitting in some of the shelving of some of the prestigious research institutes in Germany and Austria. Only recently have we now had that been accounted for with proper burials and things like that.
Thank you for that answer. So I think it's a good segue to kind of like trying to understand the psychology of these physicians, right? Like you were saying, these physicians, they participated in many ways. I can see that, they would buy into some sort of ideology where there are certain people that have lives unworthy of life, right? And, of course, that they're going to start with something like with the disabled, right? Usually they're almost like easy targets. And then you were saying like, well, that is the beginning, and eventually it becomes the Jews, right? And you want to eliminate the Jews. So how did help me understand the bridge between those two things, right? So you can deem one group to be unworthy of life, right? But not deem another group unworthy of life. So was the same mentality just applied toward Jewish people? Like, oh, they're just living, their lives are so bad because they're Jewish, and so they would be better off dead. Like, how does that make sense?
Yeah, I think I can try to take a stab at it. So just for full disclosure, I'm a physician, pediatrician, but I also have a PhD in philosophy. And so I think about these ideas. That it's a great question that you ask, like sort of what's the mechanism of how does one get from a place of thinking that they're going to do good to mass murder on a large scale. In medieval philosophy, the philosophers used to say every single person in every moral act is always trying to do the good. Okay. Now let that sink in for a second. How can that be the good? But every person, even a bad person, when they take a bad action, what we would consider from the outside a bad action, they think they're doing something good, either good for them or good for something. And I think that's important to remember. These people didn't think they were doing something bad. They actually thought they were doing something good. And so that's an easy sell if you believe that what you are doing is something good. Now, how does that work? Well, I like to think about it in terms of conscience. So I think of conscience as sort of an active force. And I'm going to use this philosophical term like a metaphysical force. That is, it stands outside yourself, and it's something that that changes with you in the actions that you take. So you ever hear so that we have this idiomatic expression, like, I want to be a better person. Well, I like to look at that phrase philosophically and look at the Latin word for be is esse, to be, right? And that carries with it a deep meaning. I want to be a better person. The operation of conscience is like that, I think, that when you do good things, you recognize yourself as the author, as the origin of those good things. And that's how we know we're doing. And then it comes back to you that I've done this. And you test this against a truth that stands outside yourself. If you know that you've done something really, really good, you feel it, you know it. And then the next time that situation arises, you're more able to act in a good way. On the other hand, there are people that don't listen to what conscience tells them. They make a moral mistake. Now, the next time they're faced with that same choice, they decide to do the same thing again. People that don't listen to their conscience, that signal of what is right and wrong becomes duller and duller and duller. And I always tell my medical students, to take a sort of contemporary teaching point from this is, as physicians, we are going to make ethical and moral mistakes. And depending on what it is, of course, but the first mistake you make is not the worst one. It's the second one. Because if you're faced with the same choice, having listened to your conscience and ignored it, then you're down a kind of slippery slope where the next decision becomes easier and easier and easier. So I like to think of it as a dynamic process where a physician in that time perhaps isn't thinking about, disabled children as one box, Jewish people as another box, but rather the fact that you've already made a series of decisions that allows disabled children and then disabled adults. All the while that those decisions are happening, the culture is changing in a dynamic process, making the next step easier to take. You've already said, hey, some lives are not worth living. Some lives are a threat to the health of the state. Now there's this dynamic process that occurs where your conscience and the culture is moving. As you've made one decision, you're moving to the next, and it becomes easier. I'll say one other thing. This is kind of a lame analogy, but let me try. In medicine, going back to basic sciences, and you're thinking about the hemoglobin molecule, right? So there's this thing we call cooperative binding, which a lot of your listeners probably remember, that the binding of the first element to hemoglobin causes a change in the hemoglobin molecule to make the binding of the second one easier, and so forth, and then the third, and then the fourth. But that's how I like to kind of think of it in my mind, as how does this operationalize, where you can start out as doing something that you're not sure of, but then the next decision becomes easier and the next decision becomes easier. Anyway, I don't know if that's helpful, but that's how I like to think about it.
I liked your comment about these are not necessarily individual boxes. And I would like to emphasize that pervasive, deep, and ongoing anti-Semitism was helpful fuel within all of this. And when we look at the history, even when disabled individuals, mentally and physically, were being euthanized, mass murdered at the time, there was always a double stigma for Jews. And it didn't matter what their prognosis was or their ability to work. They were the first ones to be killed. We also know from data that more Jewish inmates at the concentration camps that were infirm and sick were selected to go back to the T4 hospital sites to be killed there. So this was a constant theme that ran throughout. In the early 1930s, the Jewish doctors were completely persecuted, and they were not allowed to even call themselves a doctor. They lost their academic positions, and this was a wonderful opportunity for doctors in Germany to take these positions. So I don't think we can make these clear differentiations that was one thing one day and one thing another day, but this was rampant and it never went away. And it really helped fuel the level of murder within this. I just wanted to say one other point, and that was Hubert Markle, who was the president of the Max Planck Society, and he was apologizing for some of the experimentation and the things that were going on. And he said that there should never be anything in science that is more important than human dignity. And I think that some of the rationalizations here of some of the physicians at the time, from what we understand in the scientific establishment, was that they're doing good for society. Science trumps all. I mean, it's the most important thing, and I'm going to do whatever it takes. Halliburton said at Nazi Anatomist, where the brains came from was none of my business. So this is something that we have to dig deep in our contemporary teaching and think about what are the implications of this.
I think of this in terms of them and us. And as long as there's a them and an us, it's easy to want to get rid of them so we can be better. if we see them as causing pain to our lives, as causing problems with society, as them as the root of all evil, then it's easy to get rid of them, whoever the them may be. With the so-called euthanasia, which, as Dr. Wald said, was really murder of people with severe disabilities. Using the them and us model, I don't want to use the term easy, but I will, to say make the jump to homosexuals, Roma, Sinti, Catholics, Jehovah's Witnesses, Jews, anybody who is perceived as bad for the German Volk, the German people, and the Nazi Party, which were becoming one and the same. But imagine that the Nazis had won, that they were able to get rid of anybody who opposed them, the Jews, the Roma, the Sinti. They're all gone. Can you imagine that the ovens would be shut down, that the slave labor that would disappear? I think the process of refinement, of winnowing out the bad from the good, the perceived bad from the perceived good, would continue, and that those ovens would keep going.
No, thank you for that. So it seems to me that there is an important distinction to be made between, I guess, like two positions. One position is, well, I'm going to kill this person because I think death is in their best interest because their quality of life is so bad. The other position is, I'm going to kill them because it's better for me. Right? So
Yes.
it starts off, it's an easier sell to kill somebody. It's easier to justify killing somebody for their sake, right? You just say it was in their best interest because their quality of life was so low. It's a harder sell to kill other people for more selfish reasons, right? But that there is an important distinction there, and then one would lead to the other when it's fueled by anti-Semitism and this like us versus them mentality.
Yeah, I would agree with that. And I think there's no reason you have to choose one or another. And I think that's pretty clear from the tactics the Nazis used, is that they tried to use them all. There were certain regions of Nazi Germany, for example, that were predominantly Catholic, and they might not have used the other, like, because the people in southern Germany were more religious and more Catholic, they might not have used this, oh, it's better for the race or the state, but they might have used it's better for them as a justification. In fact, the cultural and social stigma was so great, taking like for having a disabled child, for example, that many parents willingly gave up their children to be placed in these hospitals because they thought it would be better for them. Now, they didn't know ultimately that many of them didn't know that their child was going to be killed, but it did have this additional benefit for them socially, which is I'm not wheeling around a disabled child in a society which hates disabled children. And I think the other thing is better for me, is a very natural tendency of all human beings. And maybe this will come up later in the discussion, but I think one of the reasons I think all three of us teach on this subject is that physicians are particularly susceptible to these, what I like to call temptations, to these temptations because we have so much power, so much prestige in society, so much trust that individual patients and society places in us that makes them automatically say, oh, a doctor's doing it. It must be good. It must be good for me. It must be good for my health. You've seen a little bit of a pullback of that, particularly after COVID. But for the most part, we're still one of the most trusted professions. So you have this inherent trust. And then on the other hand, you also have this kind of do-gooder mentality that a lot of physicians have that can almost become extreme. That is to say, if you don't understand, like if you're not a humble person or you don't understand, like, hey, medicine has its limits, you can tend to think, oh, I can do this. I can do this for my patient. I can do this for my patient. And when you run out of things to be able to do to them, then you're tempted to take it one step further. And I think that's the other, that's the temptation. But we're constantly bombarded by these temptations. Dr. Wald mentioned that Jewish physicians were expelled from the medical profession. Now, what happens when 3/4 of the academic faculty are dismissed, who's going to fill those spots? The non-Jewish physicians. So there's another temptation. We're high achievers. We like to rise in the ranks. We do that almost naturally. Now you have this opportunity to fill the spot of your Jewish colleague. Not many people are going to be incentivized to speak out against that when it benefits you economically and socially.
Yeah, and I just sort of a PS comment on all of that is when we look at the Wannsee Conference, which put together the final solution, meaning genocide of the Jews, most of them were PhDs. So when we think about this whole idea of the value of higher education and that this is supposed to help us with our moral conscience, as Dr. Fernandes discusses, it really gives us pause to think about why did the best and the brightest make these kinds of sorted decisions and feel pretty good about them.
I think that the distinction between killing them because it's better for them and killing them because it's better for us is easily blurred. If you can imagine someone essentially invoking the golden rule and saying, if I was a this, I'd rather be dead. And you can put in any this you want. If I was a Jew, I'd rather be dead. If I was this, I would rather be dead. And that makes it easy to rationalize that it's better for everyone involved.
So this is just me, and I think it might just come from me being a product of the 21st century in our current times. It's just hard for me to imagine buying into such an ideology. You know what I mean? Especially if you're educated. Like if I feel like if I was transported back in the day and I would just ask very basic questions that I don't think they would be able to answer, or at least if they try to answer them, it would just sound extremely weird, right? It's like, what are you saying about Jewish people? Can you list them? Why do you think that this is true? Right? Like 1, 2, 3. What do you think 1 is true? Why do you think 2 is true? Why do you think 3 is true? What is it about them being Jewish makes it such that they are bad? Like I don't think that they would be able to answer that question. And so because of that, it's just hard for me to imagine people buying into it. It's almost it just seems like a lot of people are like, I don't know, gullible is the right word, right, to buy in such an ideology. Because I think if you question it, if you approach it from like a critical thinking perspective, I think it kind of falls apart.
That is why studying the Holocaust is important, to understand the evolution of how this happened, to understand how the buy-in happened, to understand how the anti-Semitism emerged from its cocoon of somewhat repression by listening to the findings of the Nuremberg trials, of how physicians rationalized their actions. No one was apologetic. They did what they thought was right. They went to their deaths thinking that this was right. The Volk, the German people, everyone involved in this, everyone who was a bystander or a participant, I assume, thought this was right. They justified their own actions. But to go back and learn the history of anti-Semitism before Nazi Germany, which goes back thousands of years, that will help understand the buy-in and the buy-in of the most civilized nation on earth. This was a rational, good thing to do. This is good for Germany. Things will be better.
And I can add to that by just suggesting that although it seems just hard to believe that the best and the brightest would think this way, we have so many contemporaneous examples of where the mentality of eugenics and even death of the unfit comes into our modern society. And I can just give you a few. In 2013, in California, there was a newspaper article in the Sacramento Bee that talked about California female inmates that were sterilized without their consent. And your viewers can Google this and look it up. They were sterilized without their consent through a hospital prison program that said that the amount of money, the doctors quoted in there as saying the amount of money that we would save from essentially these kinds of people reproducing would be much greater than if we let them out and they start producing these babies. Some modern day idea of eugenics. In the country of Iceland, they have 0 babies born with Down syndrome because prenatal diagnosis allows people to eliminate those unborn children before they're born. So they brag about how, as a public health measure, they have eliminated Down syndrome from Iceland altogether. Whereas in America, we have many families who take care of patients with trisomy 21. In the Netherlands, right now, for the last 20 years, they have had a euthanasia program for children. And Canada has just instituted one as well. But they have a euthanasia program for children in the Netherlands, and it's called the Groningen Protocol, in which disabled newborns can be killed now, this is with the quote unquote, with the consent of their parents in consultation with the physician. But the physician's job as part of the protocol is to identify those children which might be suitable candidates for this protocol of euthanasia. It's interesting. There's a doctor, again, deciding based on a physical characteristic what the quality of life of this individual baby is going to be, all sort of disabled, and a parent agreeing to it. Is it for them? Is it for us? Who knows what it's for? But that program of euthanasia for the disabled has now, which started with newborns, has now been expanded to children and even to teens, who in some instances can make these decisions in consultation with their parents, but almost independently. In Belgium, they have allowed euthanasia for patients in Belgium and the Netherlands for patients that have serious psychiatric diseases. Now, I mention this because sometimes people will say, oh, the difference between euthanasia then and euthanasia now is that it was forced. In other words, no autonomy. Okay. Now we're choosing euthanasia. But in the case of a patient with severe intractable schizophrenia, they really, I think most psychiatrists would agree with me, they do not have the capacity to make an autonomous decision about life and death, and yet that was allowed. In Belgium, they allowed at least five transgender patients who regretted their transition surgeries to kill themselves. Instead of being a healing profession, medicine not only allowed it, but encouraged it. I bring up these contemporaneous examples only to say that once we have the idea in our heads that there is some other good that can eclipse the good of the individual patient in front of us, the temptation is there and very present to us. And it happened then, but it can also happen in our contemporary society.
So I wanted to say that in our teachings, and I emphasize this, I speak internationally for different groups of different health professions, education, such as medicine, nursing, dentistry, speech therapists, audiologists. And it's very interesting because I wrote about this in Hectoin with some of my co-authors. It's a humanities journal. The idea of I'm a good person. I wrote a good essay about getting into that health profession school. I'm not a Nazi. But what we're talking about here are what we think about as echoes of the Holocaust. And one of the reasons for the Lancet Commission report, and we developed a new concept of history-informed professional identity formation, is for a trainee to be thinking about looking in the mirror and what does this history mean for me? So it's easy to say, that's not me. I wouldn't be such a bad person. But then I can't help but think some of the headlines that were going on during the COVID pandemic of, oh, it's just people in the nursing homes that are getting sick. Oh, that's okay. Ageism is just fine. Or thinking about ethicist Charles Camosi's work where he talked about throwaway culture, where over half of the people over age 85, and we're helping people live much longer now, have a dementia process and have trouble with their minds and their thinking and their memory. Well, what are we doing about that? Do we care about giving them some quality of life? Or is it quote unquote utilitarian kinds of ethics of what good are you to our society today? So these contemporary issues are stark and they are absolutely relevant. And the students are going to be seeing this constantly, as are our regular clinical professionals, our research professionals, our public policy professionals, as someone once said, that the pen can be a weapon. And I just want to say, from a personal point of view, I was a family cancer caregiver for almost 7 years for my husband, who had a glioblastoma, and we had to deal with some of the issues of informed consent within research ethics. And when you're faced with a 50-page informed consent brochure or stack of papers, I was kept thinking about, what about people who don't quite understand this? Do they really understand what they're signing? Do they really understand that there may be some toxic side effects of some of the clinical trials, and making an informed consent decision? So we say, okay, I'm a good person. I'm going to do the right thing. I'm going to help the person understand. And then I spoke to some medical students at a very prestigious medical school. And I said, when you have a $2 million grant for that cancer clinical trial, and you need to get people on that clinical trial, are you going to assure that they have true informed consent? And all of a sudden, there was silence in the room. These are the kinds of things that we deal with on an everyday basis. It's not some huge ethical dilemma that it's going to be in the movies. It's an every single day decision-making process and thinking about power hierarchies, potential abuse of power, how we are going to proceed. And it can get more and more complex as we get into technology and burgeoning AI applications, and things that we're going to have to bring a sustained moral compass to.
Yeah, thank you for that. So I think it's a good time to transition to the third question, which is, what do you think we need to do in order to prevent this from happening again?
So that's, again, an excellent question. And I think that's part of the reason why all three of us are up here today, is what do we need to do to prevent this from happening again? I think one of the things that I think I've tried to do in my career is to teach this course, both in my past as a required module for medical students, and then now as an elective, or what we call an advanced competency at my institution, particularly for fourth-year medical students, to be able to teach the history of medicine and the Holocaust, but as a lens through which we can examine our contemporary ethical issues, and also the temptations we have. And also now, as we're seeing, as a vehicle for also combating anti-Semitism in medicine, which is seeing this resurgence. So one of the things is to really make it a priority that we educate students about this history in order to avoid those mistakes of the past. If, for example, medical students really believe that Nazi doctors were monsters, or that Nazi physicians were forced to do the things that they did, neither of which is true, then what have we learned from that incident? Nothing. They can take nothing from it. They have to understand these temptations are still there, and they're there in our everyday practice. And I will just say the second thing, which I emphasize over and over again, medical schools today place a lot of emphasis on advocacy, 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 and a lot of that is political. It's not that I'm against advocacy, but a lot of it is political, and it's important. But honestly, the best advocacy you can ever do is to treat the patient in front of you with the dignity and respect that they deserve. That encounter, that human encounter between a doctor and a vulnerable patient, can go one way or it can go another. And we have to constantly remind ourselves that we can have hard days in medicine, but we can never have bad days if we do what we are called to do in raising the dignity of the human person. That encounter is the best advocacy you can ever have with any patient. And if we practice that, then I really think that we can resist the temptations that led to the Holocaust.
I think we need to prioritize the moral education of the health professional on a lifelong basis, and that ethics programs, history-informed professional identity formation through studying history of physician complicity in the Holocaust, and also the moral courage and resistance that was shown by some of the physicians and nurses. We have many stories of that we use to inspire students and health professionals. It must be a required component, not an elective course, but it has to be part of the DNA of any health profession student walking out with a responsibility to the public. That is our primary responsibility, the way Dr. Fernandes was just discussing in upholding human dignity. Therefore, when I use an analogy of two pockets of the white coat, and the physician in the white coat gets a lot of honor, and people listen to that physician or nurse or other health professionals who are trusted by the public, those two pockets, you need your technical skills knowledge in one of those pockets. Absolutely, I want you to know your science, but the other pocket has to be there and also integrated, as Dr. Fernandes has discussed, on moral awareness, reflective practice, critical reflection to develop yourself as a moral agent. You're just not passively internalizing values that may be corrupted by the profession or the society, but you're constantly ethically vigilant and doing analyses with critical reflection. Am I asking the right questions? Am I doing the right thing? What are the implications of this? This must be a constant professional identity consciousness. And this doesn't just happen. It takes time. We need mentoring. We need reflective time. We need to sit with this history, grapple with the difficult realities of how this could come to be. That's how it doesn't happen again. It just doesn't happen overnight to tell someone, don't be bad. This takes time. It takes work. And we have this in the medical schools, but unfortunately, the pressures of the time sometimes scrunches away some of the ethics time and the reflective time. We must have an integration of the humanities and the science. We are putting out people as responsible educators to take care of vulnerable patients. And I've been advocating for that within required curricula. I think it's crucial.
In the Physicians in the Holocaust course, the Holocaust is used as an example of a slippery slope, one that people can avoid, one that people can learn that it is in their power to avoid. One of the main things that students learn in the class is to stand up and speak. Each month, each class period, they have a question to answer, and they stand up without notes and they speak. Another activity in the course is called the Holocaust Humanity Project, From Ashes to Action. Each student needs to do something good for someone. They have full creative control over whatever it is they do. They have full control of the magnitude of the good that they will create in the world, just like life. But they realize by doing this, I believe, that they have the power to do something that will make a difference. When I ran into one of my former students, who was then a resident in psychiatry and is now a practicing psychiatrist, I said, tell me, what did you get out of the course? What did you learn from it? And most importantly, the most important questions we ask the students is, as a result of being in this course, what will you do differently? So when I asked this physician, what will you do differently? What have you learned? He said, I learned to put my foot down. And to me, that encapsulates it all. For us all to develop the awareness of a slippery slope, for us all to develop critical thinking of ourselves, critical thinking of everything around us, and to realize that our actions count and to take them. Never again, or that this will, to prevent this from happening again, is a huge challenge. Again, we're talking about a long time period here. This is a huge challenge, but it's one that I think is incumbent upon us to take up as a challenge, to give it our best shot.
Thank you for that. Yeah, those are great answers. I feel like one of the core things that people should remember and keep in mind is that our nature really hasn't changed. Like it would take perhaps millions of years for human nature to change. So whatever biases and prejudices and, vices that people had 100 years ago, we have those now. Right. So it's not accurate to view the physicians during the Holocaust as with this us versus them mentality, right? It's like, oh, these people were just evil. They were sheep. They just bought into it, and oh well, that would never have happen to me, and that would never happen to my colleagues in med school now, right? We're almost like a different species now. We're enlightened, but that's not really the case, right? So really, what we have to do is continue to push against these tendencies and biases and prejudices, and try to correct these vices that are just with us via our nature. And we'll have to continue to do this like moving forward when it comes to the future generations as well.
I do want to emphasize within those comments that are quite astute. There was genocidal intent for the Jewish people in the Holocaust. For 6 million people to be exterminated, it had to be industry, world, throughout the culture, throughout the society, with a lot of help. And the physicians were part of that. And I think that's really tough to grapple with. Everything we've said today is tough to grapple with. But as Dr. Fernandez mentioned, we have a problem now. And when we talk about the never again, and we're concerned, what does that really mean? Because we have a scourge of anti Semitism in medicine and globally. And anti Semitism and hate of all kinds has absolutely no place in medicine. I have published with Dr. Stephen Roth in the American Journal of Medicine on the 4 E's for countering anti Semitism in medicine, of education, engagement, empathy, and enforcement of policies around this. And the education has to be what we've talked about today. It needs to include not only Jewish identity, encountering anti Semitism and the persistence of the anti Semitism, but the role of medicine during the Holocaust. That's part of one of the 4 components of this, to engage together and have empathy for all suffering and for all patients and for all our peers. So it's precarious when we use terms like never again, because we have to stay vigilant and keep at it.
Thank you for that answer. So I want to get your perspectives on what you think the most likely negative outcome will be. So for me, like I would be very shocked if another Holocaust happened, because we know about the Holocaust. But there may be something that is uh, that's something else, maybe like a Holocaust light, that right, like a lesser version of it that you think is actually quite realistic. What do you think that thing is?
Well, I can start with that. I mean, I think one thing that I think about often is the potential that we have in genetic engineering and genetic editing, that we're seeing, and um, the idea of eugenics, particularly at the beginnings of life, for example. So, with pre-implantation diagnosis, for example, that occurs in our reproductive endocrinology clinics or IVF clinics, even the sex selection that occurs, certain characteristics, that is a bit troubling. I think some of the ethical issues that surround prenatal testing is troubling. I think the idea of genetically modifying human beings, which we are there, we're there, right? So now we can insert genes and are at the verge of curing congenital deafness, for example. And I always give this example because I think people think, oh, well, that's great. Like lay people are like, oh, that's great. We can cure deafness in the womb. But tell that to the people in the deaf community, who many of whom push back against this idea of curing deafness, because they don't want to be thought of as diseased. But you can see how like a whole there's a whole series of issues that can make people eventually like genetically better, or make the perception that some people are genetically better than others. And that will that's a medical idea that will influence culture, and it will be up for the culture to decide what to do with that. Is there going to be stigma? Are there going to be disparities between people that can enhance themselves genetically and others who cannot? I mean, we're on the verge of that really in the next 10 or 20 years. So I think that's one way. I would also add that there are certain populations that just jump out to me when you see how they're treated in our society, which are addicted persons, which are people with mental illness, severe mental illness, people with dementia, as Dr. Wald mentioned. These are people that are very, very vulnerable because they lack the things which our society in the West really values. And because they lack those things, I can see it being kind of an easier road for people to start valuing them less as persons. The most important thing for me when I teach this class is to try to get students to reflect on the importance of the power of person. And if someone is a person, what does that mean? Like, why do we value them? And what does that mean we can and cannot do to them? And the broader the definition of that, probably the better and the safer our society is going to be.
Jason, I understand your referral to what else is going on that may be Holocaust-like. Certainly, we, no matter what generation, always live in morally challenging times. And I would say that within each generation, that moral challenge is something not experienced. As we move on to greater and greater challenges. But I think it's important to keep the Holocaust with the capital H as the Holocaust in describing that historical event, and not throw around that word to describe all kinds of other things.
I actually was going to say that and echo both of your comments that when we teach this history in the health professions education, we do talk about medicine during Nazism and the Holocaust, because the Holocaust has a capital H and it is the final solution genocide of European Jewry. While there are terrible things that are happening in our midst and are terribly challenging times, the Holocaust is distinctive. And we urge our students to use caution in any kinds of analogies around that. So I think that is important to note.
It's also important to know, Jason, and for your viewers, that I am not Jewish. And this is very important to me. And I think the example of how it's affected me and so many other Gentiles, I guess I can call us, are is that there is this universal message through what the Jewish people suffered and the reality of anti-Semitism now. There are lessons to be taught to every single person, regardless of your background, that enhance medicine and that fortify the virtues of medicine, particularly the virtues of integrity and humility, that fortify those so that we never fall as a profession into that temptation again about picking winners or losers. And in particular, this all I think Dr. Wald and Dr. Shuster have done this very well. But there's this temptation, I'm going to use that word again, a temptation for us who teach this now, to especially for the students we teach, to generalize and kind of gloss over the targeting of Jewish people. And we just can't do that. It's a dishonor to the people that died, and it's a dishonor to the people that survived. And it misses a very, very important point, that cultural attitudes can be baked in over literally thousands of years, and they rise again and again and again. And we have to be intentional. We have to be ready for when it comes, and we have to be intentional about beating back those cultural prejudices. So I just wanted to say that as someone who's not even Jewish, for your listeners who aren't, this is important for you too. It's not just about something that's like sitting on a shelf collecting dust in the past.
I wanted to thank you for that comment, Dr. Fernandes. I so honor you and your work, Dr. Schuster as well. And I did not note this at the beginning, but one of my credentials, if you might want to call it that, is that I am the daughter of a survivor of Auschwitz-Birkenau, Morris Wald Vosas-Voloski, who was the sole survivor of his entire family that was murdered in Auschwitz and Treblinka. And I have woven this story into the history because the power of narrative is really quite remarkable. I've taught this even on study trips to Auschwitz-Birkenau, and use that along with the history to show them true facts in a world that may get into minimizing, distorting, inverting, due to non-evidence-based global citizenship in some of the news reports, the kinds of things that we're going through now, attacking history at its core, trying to keep it in evidence-based narratives.
Thank you for that. I think it's a good place to wrap things up. Are there any final words that you want to express to the audience?
Jason, I can't thank you enough for taking the time to explore this very important topic, and I look forward to more.
Yep. And I thank you again, Jason, for having us on. And I would just like to say that I really hope your listeners and your audience realize that this is a topic for everyone in every generation. And that if you are a physician or a healthcare professional, that really, really think about what I said, that your advocacy begins first and foremost with the patient in front of you, and to never, never let another good eclipse the good for that patient in front of you.
I want to echo the thanks to Jason for this compelling piece of time for your listeners to get this out there, because we all need unbiased, humanistic, full of human dignity healthcare. All of us. We may be vulnerable in that bed in the hospital, or one of our loved ones may be there. We all deserve healthcare with dignity. We are trying our best to get this into health professions education to help create a moral compass and that is sustainable. It means so much to all of us. I have to thank the folks at Wright State University, Boonshoft School of Medicine, and Dr. Tim Freeman, who had the vision to have a conference today on this topic. We have a paper, as I mentioned, we have a Lancet Commission report for people to learn more. And our published studies that we have now showing longitudinal impact of this curriculum on moral intentions and moral actions in health profession students. This is not just our opinion. We have data on this showing the truth. And we hope that to see this required in all health professions education going forward. Thank you, Jason, for your time.
Thanks for tuning in to The Ethical Frontier. If you want to support my work, you can do so at patreon.com/ChenPhilosophy.